To COVID-19 talk with local health authorities. We have a new health authority from the county here. With us, joining us is Dr. Scott Johnson, representing Harris County, Dr. David Hurst, representing the city of Houston. Special thanks to past President Kathy Finninger, Rotary Club of Houston, our producer, Morgan Ash. I'm Stephen Williams of the Houston Health Department. Lots have happened in the last couple of weeks we've been together, so we're going to dive right into the questions. HPD and HFD have the lowest vaccination rates of city departments. As they are first responders, what has been the impact? What is their rationale for so many not wanting the vaccine? Want to take a stab at that, David?
Yeah, I'll take that one. So, it does seem a little bit counterintuitive because we do know that our first responders are some of the people who are at greatest risk of exposure. When I've talked with individuals and try to figure out why they're declining to become vaccinated, some of them have been really they have a distrust. They think that the vaccine is too new. There hasn't been enough research done, and they're concerned. I've tried to explain to them that what we're hearing in terms of the consequences of the vaccine, which the complications are even the bad ones are extremely rare, and they're far more rare amongst people who get vaccinated than people who contract the illness. Nevertheless, some of them remain skeptical. Others, and again, this is only anecdotal from my conversations, are really just they don't like the government telling them what to do, and their way of expressing that is to say, no, I'm not going to get vaccinated. And I've explained to them, you do have the right to say no. Certainly here in Texas, you absolutely have the right to say no. You also have the right to say yes and get vaccinated. But they feel that by not getting vaccinated, that's how they can demonstrate their objection to being told what to do. And it's a mixed message that from my standpoint, it's unfortunate, but that's how many of them feel.
Yep, taking the risk. I've asked someone who recently recovered whether she had reported her COVID case. She didn't go to a doctor, but tested several times with a home kit. Are we still under-reporting?
So I'll take a swing at that one, Stephen. Let me just clarify one thing. I'm not a physician with public health. I'm the associate director of our COVID division. So I just wanted to clarify that real quick. But yeah, I think underreporting is probably something that's been happening throughout the entire pandemic, going back to the very beginning. When you looked at the beginning and we were doing the massive testing, there were so many delays in getting in lab results and such, and a lot of things getting lost in the shuffle. So I think there was some underreporting there. And as this question brings up, yeah, we have these at-home test kits now, and I personally have known several people who have done exactly what this, question is asking. They've self-tested and then just kind of left it at that. Didn't inform anyone. So, I think we probably are doing a fair amount of underreporting. I guess the important thing to know is that, if the patient understands that they have COVID and they understand what they're supposed to do, then at least you're helping break that link of spread to the next individual. But knowing the numbers is always extremely important.
Thank you. Where could she report it to VAERS, the appropriate place if she did not see a doctor?
So I'll take that one. So what they should do or could do is report it to their local health authority, the local health department, based on where they live. That's how we report. We track things based on people's residence. They can also inform, and particularly obviously if they're positive, they might want to let their doctor know, just so it's in the chart. And then, should they develop any complications down the road, then the doctor will already be a little bit up to speed. But the proper place to report it would be to their local health department. VAERS is a vaccine adverse event reporting system, so that would only be reported there if they had a complication from a vaccination rather, not. You don't report illness into VAERS. That's a vaccine reporting system.
The Regent Cruise Line had a 10-case breakout. All the cruise ships seem to be taking extremely safe measures for prevention. Was this inevitable?
Well,
can you be on a cruise ship, Scott?
Yeah, well, I mean, I think when you look at a cruise ship, just like anything else, right? Whether we're talking about going to a baseball game or an NBA game or something like that, anytime you're in a confined area, and yes, I know these cruise ships are huge, but there are confined areas with a large number of people for an extended period of time. I mean, the risk exists, right? You could have 100 cruise ships go out and no one gets sick, and you can have one and the whole ship could be affected. So I think the important thing is to continue to use those individual precautionary practices, right? So, on the cruise ships, if you're out in the main dining area or, parts of the open public parts of the ship, yeah, they're probably going to be enforcing the social distancing, wearing the masks and such. But it's when you're having those individual times, right? When you're with your family or your friends on that ship and you're in a cabin or in a small group, you still need to be aware of your surroundings. And if you're not feeling well, you need to go isolate, you need to go quarantine yourself and tell somebody with authority on the ship what's going on.
Is it correct that 99% of current cases are still Delta? What is the impact of vaccines on Delta?
So it is true that 99% of the local cases here in Houston appear to be Delta, and we get that from our own laboratory, as well as we've got great partners, particularly at the Houston Methodist Hospital System, that sequence all their positive results. And so, yes, it's 99% of the cases are Delta. Now, we just this week learned that Omicron is in the neighborhood, so that will probably change based on what we're seeing out of South Africa. But so far, it's predominantly Delta. And I also want to point out that across the rest of the United States, we are seeing a surge in Delta. Now, we've not seen it so much here in Texas, and certainly in the Houston area, we've not yet seen it. But I fully anticipate that we will see another Delta wave, which is going to be complicated because Omicron is here now. The vaccines seem to be very effective against Delta, and the jury is still out on their efficacy against Omicron. Remember, Omicron was only recognized internationally, in late November, so it's very early, and we're still learning a lot about it.
Does any study now show the virus is seasonal?
At this point, no. And I think if you just go back and look at the trends that we've seen since the pandemic began, right? We had a small peak in April of 2020, and then it went down, and then July of 2020, and then it went down. And then last year in January, we just had another peak in August. I mean, I think just looking at that data right there would tell you that it's not seasonal. If it was seasonal, I think we'd all feel a lot better about the current situation.
I think you're absolutely right, Scott. Dr. Fauci says the definition of fully vaccinated could change. Would this refer to getting the booster also?
It might. It may very well. There is. It's very early, but as he says that, he's talking about a couple of things. One is, and I think particularly he's talking about with the advent of Omicron. And here's the other thing. This is going to get complicated. Like this story is being lived as it's being written, if you will. So if it turns out that in order to get protection against Omicron to the levels that we saw with Delta, that you need to get the booster, that may change the definition of fully vaccinated. In addition, I already know that the manufacturers are looking to generate a new vaccine more specifically targeted towards Omicron. And so, if that winds up being the case and that vaccine is highly effective, then that again might be a reason to change what the term fully vaccinated means. And the other thing is, I can envision a world where if Omicron really outcompetes Delta the way it appears to be doing it so in South Africa, then perhaps a year from now, vaccines against Delta won't be part of the equation at all. It'll be Omicron and heaven forbid the next one. So the definition of fully vaccinated could very easily change. We're just gonna have to wait and see.
Yes, I saw on television an interview with Dr. Fauci this morning where he was saying that they're already discussing whether or not it's appropriate. Omicron has arrived in Houston, an early wastewater sighting, or was this a surprise? Not really.
Yeah. Hey, so it's wastewater. I'll take that one.
Yeah.
So an important thing for folks to recognize is, well, first of all, the answer to the question is no, it wasn't a surprise. We're a very mobile society globally, and Houston is a international city by any way you want to define that, and so it's not a surprise. One thing that I don't know that folks recognize is when we announced that we had found the Omicron in the wastewater, the samples for those tests had been obtained a full week before. So that was the same night that Harris County reported the first clinical case. But the samples that we were testing, we have been testing them for the entire week. So those samples had been obtained a week before. So Omicron was in the neighborhood a full 7 days before those announcements were made.
Yeah, and I think that's definitely an important thing to know. And then even when we're talking about the clinical diagnosis, it's not, and I guess maybe some people have the perception of the variant detection versus just whether I have COVID or not. Those tests will take, 24 hours, maybe 48. But when you're doing the genomic sequencing, you're looking at several days. So to say, yes, on this day, we had a positive case in Harris County. Well, we actually had that for several days before. We just didn't know it because of the time it takes to run the test.
Right.
So what are the symptoms? How would we be able to tell if we had this?
Dr. Purse, I'll defer to you on that one.
Yeah, so we're still learning a lot. The reports we're getting out of South Africa are that the symptoms are milder. The one distinction, and this is very early, one distinction is that there appears to be less of the loss of sense of taste and smell, but I got to put a huge asterisk next to everything that I just said. First of all, the cases that we're seeing in South Africa are appearing to be predominantly younger people. And so one thing we've seen with this virus is it's interesting is that it seems to spread amongst certain age groups before it spreads amongst other age groups. So in South Africa, we're seeing it in a younger, predominantly in the 20-year-old group. Well, that's a healthier group that even with Delta tends to do better here in the United States. So what we don't know what will happen if 70, 80-year-olds or 2-3-year-olds become infected with Omicron. We just don't have that experience yet. So we're gonna have to wait and see on that. Now, the other thing is that if it is that Omicron has milder symptoms, as we move forward, it's going to be clinically, it's going to be very difficult for the doctor to know whether you got Delta or Omicron, or for the little ones, is it respiratory syncytial virus, or for anybody, is it the flu? Now, right now, today, we're not detecting any flu in the community at all, but we are entering the flu season. Flu season in Houston generally begins in January, so it's a little bit early, but there's a lot of overlap in these symptoms, so it's going to be difficult to know.
Omicron appears to be spreading quicker than Delta did. Have seen it described as more transmissible, more severe, and inevitable. Your comments? Not all of that.
Well, I think some of that goes back to what Dr. Purse was just talking about on the previous question. There's still so much about it that we just don't know. Right now the transition rate is, seems to be pretty high, right? But we had Delta, as we stated earlier, 99%, kind of spread out across the United States. So there's nothing proven yet that it's, more transmissible than Delta. But, as Dr. Purse reported that the early reports suggest that, it may be causing milder symptoms, but in that case, that could lead to a greater spread. People tend not to take it serious. Oh, I just have allergies. I just have a cold. It's whatever it is. And they don't take the time to go get tested. Or they just assume, well, yeah, maybe it is COVID, but I'm not really sick. So if I do infect somebody, they won't get really sick either. And a lot of times it's just through that negligence that might actually precipitate a greater spread than maybe what the virus would do on its own.
South Africa and other countries are under travel bans due to Omicron variant. Since it is already here, is the U.S., does it matter?
Yeah, I think this is a great question, and I think this is one thing that has people very, very confused. So I think that here in the very early phase, it is helpful because it may slow down how many cases come to the United States. I think that we have a misconception that travel bans are going to prevent something from coming to the United States. That's never really been the intent. We know that viruses are going to spread, bacteria are going to spread around the globe eventually, but especially since the early reports out of South Africa suggest that it may spread very easily. And I think that, Scott just made some great points as to why that could be. A, it could just be a characteristic of the virus, and B, if it has lesser symptoms, people are going to behave in a way that may facilitate the spread, which I think has been underreported in the media. So Scott, I thank you for pointing that out. But here's the other thing is that with the travel bans, getting back to the question, with the travel bans, if it can slow it down, it allows us here in the United States more time to build up our abilities to identify and track it. And it also, the other thing is that, our hospitals are already at 95+% occupancy, trying to catch up with everything from the previous waves. And so whatever time we can give them to prepare is going to be helpful for the people who 2-3 weeks from now need a hospital bed.
Yeah.
We're still on South Africa, y'all. South African scientists warned that reinfections among those who have already had COVID appear to be more likely Omicron. Does this show potential vaccine resistance also?
Well, I mean, look, it's a rapidly mutating organism, right? We've seen how many variants since the beginning here. I think it would be naive for us to think that that there wouldn't be some evolutionary pattern here in this virus to where maybe a vaccine, a particular type of vaccine, becomes less effective against one variant or another over time. But there's nothing really to indicate truth in that right now. Now you have individuals, yes, who had COVID and maybe now are coming down with these Omicron variants like you're seeing in South Africa. But what is the time frame? Are we looking at people who had COVID a year and a half ago and their immune response has leveled out? And you see a lot of variability and a lot of unpredictability with an individual's immune response, who had COVID. Now, whether you get COVID and you get a vaccine on top of it, maybe that makes you, better off in catching the virus. I'd like to hear Dr. Purse's response too, though.
Yeah, so you make great points. I'll just add there is one study that is just out from South Africa that showed that folks that were vaccinated with 2 doses of Pfizer, and they're not using both boosters in South Africa yet. So they had both Pfizer doses and they had a previous infection. The point of the study was to see how well the vaccines protected people against Omicron versus the previous Delta virus that was there. And what they show is that the folks who had both vaccine and previous infection were better protected than those who had vaccine alone. But in both cases, there was the Omicron, there was less protection against Omicron than there was against Delta. And you're hearing about this 40-fold decrease. And to a lot of lay people, that sounds like that's huge. But remember, in epidemiology and in virology, we talk in terms of logarithmic values. So while that sounds huge, it is large, it doesn't mean that the vaccines are not helpful. And I think that that's a misconception when we hear this 40-fold decrease. It's not 40-fold to 0. It's just, it's out of reference. That term is a little bit out of reference for most folks. So we are seeing that the vaccines are a little bit less effective, at least the Pfizer. Now, also keep in mind in South Africa, where I have not seen any information, is they're also using J&J and AstraZeneca, which is not here in the United States. What they're not using in South Africa, but we are using here in the United States, is Moderna. And I've seen no data at all yet about how effective Moderna is in protecting against Omicron. So we're going to have to wait and see.
Okay. Masks. TSA agents, hospital workers, and many others who have close contact with the public have received religious and medical exemptions and remain unvaccinated. Is there any regulation currently that requires them to wear a mask?
Well, I mean, we had the announcement from the White House on December the 2nd that said, for the extension of, TSA mandating use of mask on airplanes, trains, buses, any of these types of mass transport. And again, you're looking at a highly charged political comment, right? Whether or not the effectiveness of masks, whether we should be forced to wear them or not. And it kind of goes, to what Dr. Purse started in the very beginning here today, where he's talking about, well, you have the right to say no to a vaccine, but you also have the right to say yes to a vaccine. Kind of the same thing goes here with the mask, right? You're wearing the mask not so much for yourself, but for the individuals around you. Now, like hospitals and private businesses, like they can require individuals to wear masks. I think it's just something in the fact that everybody is here to do their part. And if wearing a mask is your part, if that's the least you can do to help spread the virus, then do your part.
Yep.
So we're still encouraging individuals to wear a mask.
Yeah.
Especially if you're not vaccinated.
Yes.
And if you're vaccinated and you're in close confinement inside. Loss of smell is a common COVID symptom. but according to Wiley's study, about 10% suffer from persoma, a smell disorder that distorts odor and makes them smell like sewage, gasoline, or garbage. Is there a remedy?
Yeah, so this is a good question, and the person who wrote this is exactly right. We are hearing not only about people who've lost their sense of taste and smell, but also people that are having altered senses of taste and smell in the aftermath. What I'm hearing anecdotally, and across the city, there are a number of hospitals that have got these post-COVID clinics, these long-haul COVID clinics, and to some degree, we're learning as we go here because we've not really seen this with previous viruses, right? So this is sort of a new phenomenon. And what I'm hearing anecdotally is that some folks eventually their sense of taste and smell returns to normal. In some cases, it's taking months. And also, I'm hearing about some people who have had it for months and months, and there's been no improvement. Recent study came out showing that the problem, at least with the sense of smell, so there are nerve fibers in the upper part of your nose, right, sort of at the base of your brain, that is where your smell fibers are, if you will. The neurons themselves appear to be fine. It's the cells that surround them that encase those nerve fibers that appear to be the ones that are getting impacted, and they're suffering significant damage from the virus. And sometimes apparently they're able to heal themselves, and in other cases, at least so far, they've not healed themselves. So, at what point do you decide it's permanent? Is that at 6 months? Is that at a year? Is that at 5 years? I don't know. But this has only been around for about a year and a half now. And we still have some folks who've not recovered their sense of taste and smell, and others have. So we'll have to wait and see.
A friend who had COVID months ago continues to get rashes that appear and disappear. Is this a long-haul symptom or coincidence?
Well, again, I mean, go to what Dr. Purse just said, right? We don't even know, right? The virus has only been around a year and a half, 2 years, when it's first discovered. We don't know what all the items are. Normally it's you look at your standard flu infection, right? You get the flu. When you get over it, 6 months later, 3 months later, for the most part, and the majority of people, you're okay. These long haul symptoms are something that kind of throws a wrench into the whole deal, right? How long do you still treat COVID? And like Dr. Purse is saying, with the sense of smell lasting, months or maybe even years, it could be something new that's starting on with the rashes as well. I mean, I personally know someone very close to me who had COVID back in August, and some days can smell and taste to a degree, and then other days it's almost nothing. It sort of like goes in little waves. So I think time will tell.
There's still a lot that we don't know about COVID and its long-term effects. Reba Test, a local startup, created an antibody test that checks COVID immunity level in 15 minutes. What are you hearing about the accuracy? Read that in the paper a couple of days ago.
Yeah.
So I've not. I mean, I've heard of it. I've read one source of information that gave some data. It looks pretty good. I think that like everything else that we're seeing at this point, we're hearing a lot from the manufacturers, and we need to wait until whether it be a test or a vaccine or a antibody or anything else. I'd like to wait until it's out and being used in the public and see how it performs in the real world. I'm not trying to slam anybody, but sometimes the manufacturers give these really rosy pictures of how good their product is, and they're often accurate, and sometimes they overestimate. So we're going to have to wait and see. But the point is, if this really does give an idea of your immunity level and it's accurate and reliable, that will be very helpful.
Yeah, and I know they're waiting their fast track approval right now, and there was some question over what the exact regulatory mechanism and such was on this, but I mean, it's promising.
Wouldn't it be better to get a full dose of the Moderna vaccine as a booster?
Well, let me jump on this. So one thing to keep in mind is that the first two Moderna doses were 100 micrograms each, and the Pfizer ones were 30 micrograms. Now, a one microgram of Pfizer is not necessarily equal to 1 microgram of Moderna. So the manufacturers will tell you that. But when they went to the lower dose for the Moderna booster, that was because their data suggested that it still provided the increase in the immunity that we were looking for that we all are looking for, but it had lesser side effects. So that was one of the problems with the shots, is that people were suffering a lot of side effects. And what Moderna felt was that the difference between the half dose and the full dose was only that you were going to suffer more side effects and not necessarily get any clinical benefit. Now, that having been said, I am already hearing talk that in anticipation of Omicron, that they may go back to recommending that their booster be back up to the full dose again in order to give you protection against Omicron. And we'll have to wait and see. But that's what I know about why they went to the lower dose on the Moderna booster.
So you answered the next question, at least addressed the next question regarding Moderna's consideration of that full dose.
No.
Since we keep hearing about those constant mutations, creates a new challenge for vaccines. Do you believe that the plan is still to opt for the boosters rather than an entirely new series of shots?
I mean, it's technically possible to create variant-specific boosters, but you're looking at something that's happening in real time. Whether or not the boosters are going to be able to be created, tested, and approved while the variant is still impacting the community. That's hard to say. But existing vaccines have shown effectiveness against the existing variant. So we continue using those unless a specific vaccine variant has been developed.
Gotta ask this one. I'm not eligible time-wise for the booster. Is the wait critical, or would it be okay just to get it now?
Wow, that is a really difficult question to answer. So
I'm glad you got that one.
yeah, you owe me. It's a really difficult question to answer. So the interval for the booster was not just a willy-nilly, guesstimate on the part of the manufacturers. The problem is that, to best answer your question, I would like to know, be able to see what it is at different time intervals. And we don't have that information yet. The manufacturer has, and they came out with what they felt was the optimal interval. So if somebody's not yet eligible, the current understanding is that you would, in order to get the most protection from your booster, you should wait until you meet the threshold, the 6-month window. I don't know how much you lose theoretically by getting it too early. And certainly if you're late, and for anybody who's beyond the 6 months now and you haven't got your booster yet, yes, go ahead and get it now. Don't wait any longer. But I don't know that I would get it early necessarily.
Just for the record, if you go to a City of Houston clinics, bring you for that time interval. They're not likely to vaccinate you if you aren't 6 months past that. One last question. Is it too soon to see any impacts from Thanksgiving?
Well, we're what, 2 weeks out today. So it may be not so much in the fact that it's too soon for individuals who have been sick from that, but actually getting the test results and seeing the reporting numbers come back in. If you went and developed symptoms 6 days, maybe 10 days after you had a Thanksgiving, holiday party, and then you developed symptoms and you got sick, and it took 2 or 3 days to get your lab results, and then a couple of days for those to get into your local health department, we may just now be starting to see some of those numbers. But at least on our end here in Harris County, we have not seen a dramatic increase yet post Thanksgiving, and I'm knocking on wood that we don't.
Well, I think we should knock on anything that we could if it would help us see a reduction of cases. I want to thank y'all for joining us with COVID-19 Talk with local health authorities. New with us was Scott Johnson, representing Harris County, Dr. David Perch, representing the City of Houston. Special thanks to past President Kathy Finninger, Rotary Club of Houston, our producer, Morgan Ash. I'm Stephen Williams, the Director of the Houston Health Department. See you next time.